Insight Treatment is an IOP PHP facility designed specifically for teenagers and their families with several locations across California. It's a great option for teenagers in need of substance use and mental health treatment because, as we all know, they have their own unique needs and struggles. And so I'll pass it on to Genevieve and Susan to share more.
Well, thank you everyone for joining. My name is Genevieve. I've been at Insight for a few years now. I'm currently the Director of Clinical Outreach. So I do all of our networking and just representing Insight out in the field. And then I brought Susan along here with me today to kind of represent the admission side of things, because that's who you would be directing any referrals to.
Thanks, Genevieve. So thank you everyone for taking your time out on a Tuesday to hear about us. My name is Susan Reuven, and my formal title is Director of Family Services. I am part of the admissions team. And so I had just said, we are an intensive outpatient program for teens and their families. I think one of the things that's really important to note is we're a family systems program. So our teen is not the identified patient. The family is our client, and that is really important to us to be working with the entire family. We all know, that family systems is really what we're focusing on when we're focusing on teens. Especially when they're living in the home, and in outpatient, of course, they're living at home. So they can certainly get better with good treatment, but the chances of long-term success really are when the whole family can make some changes. So I'll get back to that approach, working with the family in a moment. As I said, we're an IOP and a PHP. We've been around for over 25 years. We treat adolescents from 12 to 18. And I think our claim to fame, for lack of a better way of putting it, is that we are a long-term insurance-based program. So, most PHP IOPs are about 4, 6, 8 weeks when you're lucky. We actually run our program for about 8 to 12 months. So a lot of people wonder, how is that even possible when you're working with insurance? We have a very strong, thanks, Alicia. We have a very strong utilization review. I didn't know you were doing that, Genevieve. You just threw me off completely.
Oh my God, I'm sorry. I thought I would just throw up some info while you guys are listening to our dear.
I love it. No, I love it. It's just like my screen went zoop. So like I said, an average of 8 to 12 months. And back to our UR department, we fight really insurance up into the state level. So what happens is when our families come in, we do ask them to work with us on the insurance side. So when they get that first denial letter that services aren't covered, that they don't panic, and that we work together with them to, like I said, to do an appeal with the insurance. And we're really successful in that. So, and I think that what we find is really tremendous success due to a long-term model. And we know that change takes time. Treatment's not linear. So we even welcome those baby steps forward and then those backslides. It's really a part of this process. And I think without those, we can't really continue to move forward. And as far as insurance, just so you know, we are in network with Anthem, HealthNet, Optum, TRICARE. But as I said, we're pretty successful with single case agreements. Unfortunately, Medi-Cal does not cover our services. If someone does have Medi-Cal, well, it happens to be right now that I guess because of this hurricane, hurricane, whatever we want to call it, insurance does have open enrollment for, I think, about a month for families that do want to switch and have private insurance. I think that there is this open place right now. But if a family has Medi-Cal and someone is feeling like, I don't know what to do with this family, please always feel free to send them our way. We're huge with community service, and we really believe that's important for us, even if a family's not coming to Insight, to really kind of wrap our arms around families and help them find treatment. So with the amazing work that Genevieve does as well, is that we have really a database and work with so many other programs within the community to be able to provide families with outlets. So who are our clients? What's the process to get them into treatment? Some of the kids are struggling with, of course, we know this already, you guys, I think, are all in the field, depression, anxiety, suicidal ideation, self-harm, substance abuse, social media addiction, things like that. I think, Denise, I'm not sure if you are asking a question or if you're just not on mute, but I'll keep going and just in case. So if we're back to this, what we're treating, our kids really come in, as we know, with maladaptive coping skills. Usually they're struggling in school and social situations, they're isolating, they're sitting in their rooms, there's family discord. But I would say that the commonality with all our kids is that they're really struggling with their emotional world, and they have been struggling for quite a while by the time they get to us. Some of the kids have been seeing an individual therapist for a while and it's just not enough. Or a lot of kids are stepping down from residential programs, and now we get the opportunity to work in depth with the entire family in real time. Same with kids discharged from the hospital. Our hope is that kids can stay at home and work with the entire family. I'm so sorry, my phones are turned off. There we go. That they can stay in the home and we can work with the whole family. As I mentioned, families are coming to us and they've been referred by hospitals, residential programs, their own clinicians, psychiatrists, group practices, and also those brave families that are searching the web, which always just like the thought of somebody just trying to find help and they're just, desperately Googling just sometimes breaks my heart. During that initial phone call to us, we'll gather information, we'll run their VOB. If they're, like I said, not an appropriate fit, we certainly want to hold their hands until we find a good fit for the family. That's where we really reach out to everybody in the community. And we do this because we pride ourselves on being really community oriented. It takes a community, it takes a village to help our youth, to help our families. And we strongly believe that kids heal through community and not in isolation. During COVID, we stayed open. That was something really important to us, for our kids to see each other face to face, for them to be around each other, not just be together from the neck up, but to actually see each other's body movements and feel that positive energy when they're, getting treatment and they're feeling better about themselves. We really find that is something that being together in person is something that's really infectious. So once we gather that information, as I said, we'll run the VOB, we bring a family in, we do a tour, and actually our admissions and our clinical director are the ones that are meeting with the family. And we take the opportunity to gather data from them. We're very transparent and clear of what it looks like to be at Insight. We really are a program that does not shy away from those really difficult conversations. It's a huge commitment, and we don't shy away from letting the families know this. We're not trying to lure somebody into our program because they're desperate. We really want them to know what this looks like. It takes a lot of courage for a change to happen. And, our families really need to be curious and authentic and honest and be able to commit and have trust in us and vulnerability. I mean, that's tough. That's a tough journey. And we have no judgment when somebody's just not ready for that. And we understand that, and we'll help a family find a program that might not be as rigid. I don't want to say rigid because that's not the word, but as tough as we are. So we let parents know what may be coming down the pipeline and, how to hold those boundaries so their child can settle into treatment. There's no doubt first couple days there may be a honeymoon period, but they're going to want it, So we're here to support them so they don't throw in that towel. It's not easy. We respect it. We understand it. We have a lot of empathy for the commitment that families are, making. We really want to address all aspects of their lives. We look at the emotional, the psychological, the spiritual, the familial, the academic, the biological factors. Every family's different. They come in with different needs, with different issues, dynamics. And that loops back kind of to the approach of working with the entire family. So back to what we were talking about, I think Genevieve talked about, or I talked about how many locations we have. So we have programs in Van Nuys, Santa Clarita, El Segundo, Pasadena, El Monte. Those are all of our local Southern California programs, which I'll focus on. And the kids come 4 days a week. They come Monday, Tuesday, Wednesday, Thursday in the afternoon. Each location has one evening we call family night. And we run a very intensive program group where programs are working on their own core issues. The group is both process-oriented and psychoeducational. Thanks, Genevieve. We keep parents really focused on themselves and really not an opportunity to talk about kids, but to talk about their own core issues. After that group, we feed everybody dinner. In all honesty, it's not a 5-course gourmet dinner, but we do bring in kind of local takeout from the community, feed everybody, and then we come back together after that for a multifamily group, which can be pretty intense. In all honesty, our clinical director and our therapists actually work with a family in the middle of the multifamily group to process some pretty tough emotions in the midst of the group. And they receive really in-depth and heartfelt feedback, both from the kids, the parents, the Insight staff. It's pretty profound to watch these courageous kids supporting parents and even confronting parents and even talking about what their child might be feeling from a different place where a parent can hear it from another child. So I actually have goosebumps when I talk about that as I'm bringing that up, because it's really different and really impactful. So on top of our family night, the 3 other evenings of the week, they receive weekly and individual sessions, and then family sessions. Our groups are run by our clinicians. They're run by the therapists. Sometimes the clinical director's there, so they can always be pulled out as well if need be. If something happens, they can be pulled out by their therapist at any time. So, obviously for insurance reasons, we have one formal individual session, but we can certainly do more than that, whatever the kids need. They're in process. They have process groups, experiential therapy. All of our master doctoral level therapists have expertise in various areas, of course, CBT, DBT, psychodynamic, EMDR, TRM, experiential. Don't ask me too many questions about these because I'm not a clinician. So if you really dive into what is TRM, I might not even be able to really give you a good explanation, but somebody here probably can. We also, of course, do art therapy, drumming, music, improv, things like that. We are a dual diagnosis program, so we also have counselors that are specialized in addiction. I would also say, though, on top of, I said we've got all those modalities, but primarily we really focus on process work. And I think the reason why, I know a lot of people are like, do you do DBT? Certainly we have DBT groups, but because we're long-term and we're able to focus on process and slowly kind of peel back all those layers, we get to the place of what's really going on. And when we can find what's really going on, it makes it a lot easier for us to implement those coping skills that kids can really use. And they're not just asked to use a coping skill on top of, their deep-rooted anger and their deep-rooted pain and trauma and anxiety and things like that. So we hope that these thoughts and feelings become more integrated as we're doing a lot of process work. We find, like I said, that we can utilize those coping skills more effectively after they're doing that. So I said that our clinical team and our counselors are on site. They're running our groups. I talked to you about being community oriented, kind of thinking about what's important. Genevieve, you're always willing to jump in. Our faculty and facility are always open to working within the community. As you can see right here in the picture, we have a huge warehouse space. We are happy to open that space to others for the community to utilize our space. We run 12-step groups that they're not paying us anything. They're just coming. I believe they're not we're not charging
No,
for that.
they are not.
And
Same
they're
with any other organizations who have like a fundraising event or any sort of event in the community, we open up our space to that as well, free of charge. So um,
thank you for
keep
bringing
in
that
mind.
up. And that's, yeah, and we're not there on Friday, Saturday, Sunday. So there's a lot of time to be able to have that space. Mornings, there's that opportunity. Some of you may have heard, just want to throw this in as well. I know we're coming to the end of warm weather, but some of you may have heard of our infamous dolphin safari, which I laugh and love that we call it a safari. But our Insights owner, for anyone who knows Frederick Schulin, who's from Denmark and really believes in sort of the outdoors, and he takes people in our field out into the ocean to chase dolphins. I finally got to be on one of them. He flies out into the really deep into the ocean, and people jump in the water. It's really an amazing opportunity and experience to have. If anybody wants videos, we've certainly, Genevieve and I both have them. So
I also want to bring up while we're on the subject of the outdoors that we take the kids on 4 trips a year. So we get all the facilities together to go away for the weekend. It's usually in like a camping setting or an Airbnb style. So we go to Big Bear twice, we go to Joshua Tree, and we go to Catalina Island.
And, just to add into that, funny enough, we were on our way to Catalina, happened to be that wonderful weekend of the hurricane. The kids were already down in Long Beach about to get on this, or maybe they were still on the way, whatever it was. Last minute, it was canceled. So the kids actually just this past weekend went to Kern River, which of course everybody's like, you went to Kern River? That could be a little scary, but they had an amazing time. And so we ended up kind of diverting and going to Kern as opposed to Catalina. But the trips are wonderful. And a lot of these kids are petrified to go on those trips. And even the parents we get a lot of pushback from the parents. So it takes a lot to get everybody on board. We do call it mandatory when our families come in, so they can start kind of wrapping their head around it. But it's just a wonderful opportunity for the kids to be just outside of treatment. There's not treatment while they're there, and kids, unless of course they need it. Certainly there's kids that in the midst of things, they do need some clinical support while they're there. But basically it is, I'm going to let Genevieve answer all those questions as they're coming in, because I have a little bit of
I got
I have a
you.
little bit of ADD, and if I start trying to answer those questions and talk to you, I'll be stumbling over myself. So I'll let her do that. But we can certainly talk to you about any of those questions about where we're located, what we do. We don't do Zoom, so our kids do come in person in Southern California. Just to name them again: Van Nuys, El Monte, Pasadena, Santa Clarita, El Segundo. I think I got them all. We do have programs in close to Northern California as well. If you guys want to talk to us about those, we're happy to talk about those. Were you going to jump in, Genevieve?
No, I was just gonna take over the chat, so I got you on the locations.
Oh, wonderful, thank you.
But I have a question. So it sounds like you do have a program in Modesto, but a lot of your outings are in Southern California. It sounds like all of them are in Southern California. So what do the kids in Modesto do?
So that's a great question. Sometimes I'd say since there are 4 trips a year, it's kind of a lot to schlep them down here every time. So I would say for 2 out of the 4, they do them more locally. They go to either Pismo Beach, or there's a lot of great hiking areas up in the Central Valley as well. And then the other 2 times we get a van and have them come down here. We usually have a big slumber party at the warehouse the night before. And so they come down the night before, and then we take them all out with the rest of the locations here.
Okay.
Any other question? I think I pretty much covered everything. I hope so. I would love for you guys to ask questions between Genevieve and I. Hopefully we can answer all of your questions.
Yeah, I'll answer Jenny's. We are private insurance based, but yes, we do provide scholarships. If the family is a really good fit, and they're going to be committed to the program, they're going to come every day, and it's a really good fit, then yes, we will scholarship them in.
in regards to that also, I'm gonna tack on a little bit more in regards to that. So oftentimes there are denials in insurance and we may not win a denial. What we really do look at is what is the family's commitment. If we've got a family that is committed and we are seeing growth in this family, we are going to jump through hoops. And in all honesty, if there's a family 1 foot in and 1 foot out, there is, unfortunately, we are, going to have to look at that and talk about private pay. And at that point, we really do need to see if a family is committed to treatment. So if they are, we're going to do anything we can to keep helping that family. Thanks, Jenny.
And then another question, so I had, because I'm in Sacramento, and Modesto is probably an hour and a half away, maybe. So the groups are Monday through Friday from what times?
They're actually not Monday through Friday. And I believe Modesto, if I'm not mistaken, Genevieve, maybe is 3 days a week. And it's, I believe their program is also 4 to 7. But I will tell you, if a family is an hour away, and I think Modesto right now is running a hybrid, so there is some of the
Yeah,
treatment
so
online.
yeah, sorry to jump in. We are
Oh,
kind of
jump in.
experimenting with a hybrid model. Insight's fundamental belief though is like based on the kids really need to be in person. But we do see like the trend in this hybrid model, and obviously we want to help as many families as possible. So we're kind of trying that out in the Modesto location right now. So we are able to kind of extend to Sacramento and some of those other areas more north.
By
So
virtual?
they would be able to, yeah, come virtually.
Okay.
Which sounds a little bit of a conflict of what I was saying earlier, right? Which is we do want the kids to come in person.
Yeah.
We also really understand that there's so many remote areas where kids need treatment. And so we are, really looking at how we can help families that are a little more remote.
It's definitely better in person.
Yeah,
Absolutely.
especially for teenagers.
But it's better than something, something is better than not being able to have treatment.
Exactly.
Again, we'd love to answer any questions that you have. I don't know, Aya, where we are in regards to timing, but while we're all together, I would love to be able to answer any questions you guys have.
What kind of, do the kids get one-on-one also?
Yeah, so as I was saying, there is individual therapy. Formally there's, thank you, Aya. Formally they have one individual session a week, but our clinicians are all running the groups as well. So if our kids need additional support, they can be, taken out of group, or they've got a lot of opportunity to get one-on-one outside of a formal once a week individual session.
Yeah, okay, great, thank you.
I've been trying to find, we have so many trip pictures, but I obviously don't want to expose any of the kids. So here's the one I could find of a trip in Big Bear last year that we went on.
That's awesome. Yeah. We got some great pictures from Kern that they just went on this past weekend, but I don't think we've happy faced the kids on our Kern trip. But yeah, we got great feedback on that trip as well. Any other questions? Oh, I see all these chats. I guess
I love all the happy faces on the pictures.
Just to maintain a little privacy here. Treatment is, I'd say it's a little longer than 4 to 6 months. It's 6 to 8 months. So we do pride ourselves in being a long-term program. We do kind of want to see the kids through. Some of these kids are even here up through a year, 12 months, depending on their need, but we do really kind of want to see them through the whole school year and the ebbs and flows of the family dynamic throughout the year. So the long-term piece is very important to us.
Yeah. I'm just now going through and kind of looking back at the chats, and sounds amazing for the kids. It really is. What does it say here? I know we get 11-year-olds coming in a lot too. Yes, you did get it first. Okay. So unfortunately 11,
Youngest would be 12.
Yeah, the youngest
Yeah.
would be 12.
Just because
Um,
the milieu tends to be around like 15, 16 years old. I'd say it's probably like the average. So it's just to kind of maintain that dynamic. Like an 11-year-old probably
Most-
wouldn't be appropriate.
Most places only do like 13 and up, I think, and so it's sad when we get 11-year-olds coming in a lot too.
Yeah, definitely.
We're finding that more and more. I used to say COVID, people would come in a couple months into COVID saying their kids, it's really COVID that started the issues. And we know that is really wasn't the case, 3 months into COVID, that it's really, we find, right, that so many things go on with kids developmentally at 8, 9, 10 years old is when a lot of these feelings of emotions bubbling up start to happen really at a younger age. But now we are really seeing a lot of effects with COVID on the younger kids. We're finding that because of the fact that they were 8, 9, 10, during COVID, and now really at 11, so many of the kids, it's always been an issue, but I think we're finding more so now that we're noticing a little more of the emotional toll that kids had going through COVID and being so isolated. Anything else? Anything, Genevieve, that's important before? I know I said we only had a few minutes left.
I know, I think you about covered everything. I could share a couple more pictures if you guys want, just to get an idea. This is the Modesto one. So they're all going to be in this kind of like a renovated warehouse situation. We do feel strongly that the kids need to feel like comfortable in the environment in order to open up and have treatment be successful. So we want to create this clubhouse feel, and so that includes like basketball hoops and
Animals.
yeah, dogs. We're extremely dog friendly.
Yeah. We have one of our kiddos in our Santa Clarita office that keeps bringing in lizards and chameleons and bearded dragons, and
Yeah.
every day she's bringing in her new therapy pet. So we welcome that.
Oh, the dog is so cute. That's actually Frederick, our CEO's dog. He's kind of the Insight mascot.
Are there any other questions before we move on to the raffle? All right, it's raffle time.
Woo!
So we've got about 20 names in here. In my little Tupperware. Let's see. Oh, there's gotta be one. There it is. Our winner is Azita Malone. Are you here? I see them. They're muted. Yes. So we'll be emailing you the $50 Amazon gift card. And everyone else, look out for your emails from Genevieve with more info and with your Starbucks gift cards.
Yes, I will follow up with all our brochures and pictures and all that good stuff, and how to best contact us, and as well as the Starbucks gift cards. So
Thank you
guys.
everyone for coming.
Thank you so much. Thank you for allowing us to present, and good work on all of you, what you're doing out there in the field. We really appreciate everybody.
Thank you.
Thank you guys. Have a good day.
Have a
Bye,
great day,
everyone.
everyone.